Latino populations from Pensacola to Key West. But Miami and Fort Lauderdale are our main populations. A lot of progress has been made in testing Latinos in our state. Since 1999, there's been a 199% increase already in testing Latinos, but we have not reached the 100,000 mark. Now keep in mind, Florida is still probably the #1 state in the country for our testing program. Last year we tested 410,000 tests in the state of Florida. That's a new record each year. And Latinos were in the 90,000 range. So we've made a big leap here, and the Latino leaders came to us and said, we want to do 112,000 tests by 2012. And I said, well, do you think you can reach the goal? And they said, heck yeah. And they said more in Spanish, but I didn't get all the words. So this is a testimony to the commitment made by them and other Latino leaders in our state. Normalizing education and testing about HIV/AIDS in Latino communities is critical to reducing the stigma so often associated with this disease. If we don't talk about it, folks, we're not going to get better about it. Making testing a routine part of healthcare visits and ensuring those who test positive receive medical care earlier would help to stop the spread of the disease. The only way we can reduce HIV and AIDS in our state is for all of us in government and the community to work together to promote awareness, HIV testing, and access to treatment. The department's commitment to address HIV and AIDS among Florida's Latino communities will not waver. Reducing new infections in our state and the Latino population is going to take continual and consistent and dedicated efforts. And I, along with the other leaders here, promise to do just that. I'll end by saying that I believe there's some help on the way, besides the leadership that you're seeing in this room and others that we'll meet with in Fort Lauderdale and in Tampa and in Orlando, where this initiative will get kicked off. In order to help with this issue takes money. So I'm happy to say that there is some money, there is some help on the way as it relates to South Florida. There's a special grant that is going to just arrived in our office this week called ECHIP. That's the 12 City Project. $1.5 million for prevention in Dade County. Also arriving this week is $1.2 million from SAMHSA, the Substance Abuse Administration. You have one of the best providers of HIV prevention and care in the room, Rick from Care Resource, who received one of the most outstanding grants in the United States in a couple of categories, both for primary care and testing minorities, predominantly young black men.